All right, good afternoon, everyone. How are you today? My name's Luke. I'm the External Relations Specialist here at IDF. Before we get started, I want to talk to you about the surveys we conduct to evaluate your IDF National Conference experience. You should have received an email prior to the conference with a survey link. We thank you for completing the pre-conference survey. We will be also notifying you of a post-conference survey where you can provide feedback on the session and all sessions you attend. At the conference, you will be notified through the conference app, and you will receive an email to complete the survey. We thank you in advance for completing it. Your feedback is absolutely vital as we understand the true impact of our conference. Questions will be answered at the end of the presenter's talk. Please write your questions on the cards, which will be picked up at the end of the presentation. The presenter will answer as many questions as possible during the session time. Now, it is my pleasure to welcome you to the Health and Life Management session, Beyond Your Current Treatment, Complementary and Alternative Medicine. The session will be presented by Dr. Terry Harville. Dr. Harville serves as a medical director within the University of Arkansas for Medical Sciences. Please join me in welcoming Dr. Harville.
Luke, thank you for the kind introduction, and as always, I'd like to thank the IDF for thinking about me to bring me out to see if there's something I could add to the meeting. I always appreciate that. This is a discussion today is one that first gave at the last IDF meeting, and I just wanted to point out that there's nothing financial here. Nothing is being paid to me. Will not make any money regarding this. I'm not trying to sell you anything that would otherwise make any money for me. The other thing is that this is a relatively difficult and complex topic. And we're going to go over some of the issues that will turn out to be good, bad, or ugly, unfortunately. From disclaimers, I'd like to point out that I'm really not an expert in this area. I was just asked to do it and then put some things together, and it seems that these are topics that people are interested in because they don't hear them otherwise. When trying to convey information to all of you that in the audience in your individual specific needs is very difficult because everyone here has other specific needs that they're trying to take care of. And so it's always easier to talk one-on-one with somebody to help guide them what they need. After the discussion today, I'll hang around for any questions that don't get answered during the time period and be willing to try to answer those for you. The other thing to point out is that the slides, I'm giving them to the IDF, and so as we go through, if there's something you don't catch on any of the slides to present, you should be able to get them from the IDF and be able to read them at your leisure rather than in a format like this, which can sometimes be more difficult. And I want to point out that the things I discuss, make sure you are discussing with somebody. Just don't start doing them on your own without somebody understanding and agreeing and helping to guide you along the way so that we don't have anything bad come out for trying things that you probably shouldn't be dealing with. When the presentation is completed, I'd hope that you have a better understanding of what some of the major issues involving complementary and alternative medicine are about. But what I'm going to be discussing are my views of things. So, as I said, one immunologist's view, and this may differ from what individuals will think and say. But once again, please discuss anything you think you'd like to try with someone that has more knowledge about it before you undertake it so that you are helping yourself. I am going to go over talking a little bit about vitamins, amino acids, other types of supplements, essential oils, probiotics, briefly on chiropractic care, acupuncture, hypnotism. Something I didn't talk about before was helmintic therapy. I'm going to briefly mention that. Minerals is at the bottom because to get this in 30 minutes, I had to leave something out. So the slides for the minerals are at the end. If it turns out that we have enough time to discuss those, I will. If not, they'll be on the slide set you can get from the IDF to look over the information I have. What's interesting there is just yesterday, new information about iodine deficiency came out. And iodine deficiency in individuals can result in worsened cardiovascular disease. And so there's another one that we need to be looking at and thinking about. So let's start with definitions of what complementary and alternative medicine are about, just to help set the stage for what we're dealing with. And the definition, according to Merck, the Merck manual, which is used by a lot of health physicians and health professionals on how to think about taking care of patients, is a healing approach and therapies that are not based on the principles of mainstream conventional medicine. And so what we think of as our allopathic Western medicine, these are beyond that, outside of that scope. Generally, it refers to, again, unconventional practices that are not part of the mainstream medicine. And alternative medicine tends to refer to using of these practices rather than mainstream medicine. And that's, again, where problems can arise when these things are used in lieu of medicine that otherwise might be helpful and may be carrying out the job that it should be. Integrative medicine is another aspect of this, which is actually combining the approaches together. So we look at the conventional approaches, so our normal Western allopathic medicine, plus the complementary alternative, and try to integrate these in a fashion, again, for the better health of the patient. And so not just look at the patient, give them a medicine, but think about their nutrition, think about other aspects of care that might be very beneficial. I want to start with the term homeopathy and its definition, because this is confusing, because most of the things that are described as homeopathic aren't really true homeopathy. So homeopathy is a very old term, and it derives from the concept that uses a substance that causes a symptom. If you dilute it down very dilute, it will cause the opposite. And so the usual thing where this description of this would be if something causes you to vomit, so like there's a root out in the woods that you eat and it makes you vomit. If you take that root and then grind it up and dilute it in water and then dilute it again, keep it to this very, very, very dilute, so nothing of the original material remains present, then this supposedly will then stop vomiting. And what happens is you end up with just water because of the dilution. You've diluted all the material out of it. And the concept was that the water retained the memory of the material that had been present, and that memory is what, when it gets into the body, helps prevent the problem that was occurring, so like vomiting. And I actually have a hard time believing that that process exists in that manner. And so I don't believe in homeopathy the way homeopathy first came about. But now homeopathy is used in a more sense of folk medicine or traditional medicine rather than homeopathy. So when you go to the store, generally when you see something that says homeopathic remedies, it's talking about natural remedies. And these are not true, correct homeopathy because they actually contain something. They may be a root of a plant or some other part of a plant, the petals, flowering parts, or the leaves, or extracts from the plants. And so in this case, there may be some validity because these are things that over time people have utilized and found they were beneficial. As an example, the bark of the quinine tree will have quinine present that helps treat malaria. And so there's some validity, and most of the medications we use are originally from some form of natural source. For example, the antibiotics first came from bacteria and then would be modified to try to enhance their strength and their ability, but again came from a natural source. The thing to remember, though, if you go to the store and we're dealing with unregulated products, that there's regulations have been, these are not FDA looked at or any other regulatory agency, and so you might be buying stuff that contains just water and doesn't contain anything that has any therapeutic benefit. But natural remedies, I think, are what we all would like to think about having, something that provides us benefit without harm. And for thousands of years, people have made observations that have led to the use of a variety of substances and materials that have provided benefit. And traditional Chinese medicine has come out of this approach. And most of the practitioners get very well trained on what items are very useful and know what roots or what leaves or what other substances are going to contain what's necessary, knows how to mix them in a manner that can be concocted into something that can be very useful. And so people that practice traditional Chinese medicine and are well attuned to what's going on can actually be providing very good benefit to many individuals. The thing I want to mention at this point, though, is any of these things cannot cure an immune deficiency and should not be used in lieu of medications that actually do and are known to provide benefit. So any of these things that we discussed should be used as adjuncts for trying to help people achieve better health. One of the other issues that when you look at many of the things that are sold as either homeopathic, natural, or complementary medicine, is they're sold via testimonial. So there's not a study, there's not something scientific that is proven that is worked in what we call a blinded fashion. And so if somebody's trying to make a profit by selling you something on testimonials that I drank this snake oil, my hair grew back, my acne went away, my muscle, I gained muscle, the fat on my body went away, my kidney disease disappeared, then they are trying to sell you snake oil. And so you always have to be very careful and not buy into the fact, because even the people are well-meaning, that because of individuals' needs, if you've been going to see your physician and they've been treating you and you're not getting better, you've gone to another physician and you're not getting better, then you become more susceptible to somebody that has that cure-all that appears to be just what's needed to make you better. And so just be careful, because you can spend lots and lots of money for things and not be achieving anything of truly any value for you. And so once again, beware of the snake oil salesmen that are trying to sell you things that appear to be good at face value for what they're telling you, but may not truly provide you what you need. And one of the other things that I'd like to point out is the modern medicine that we really do is relatively new in the context. So and the counter argument is that we're dealing with something that's relatively new, whereas many of the natural medicines, again, traditional Chinese medicine, have been around for hundreds, if not thousands of years. And so there's validity on both sides. Many of these observations are made with the natural products and do work, like the bark that can be used for dealing with malaria. White willow bark in the United States was used for a long time to treat arthritis. Native Americans knew that. It contains aspirin, and so you can get aspirin from it to treat the disease. Back to one of the dilemmas again is these products are not under regulation. So what's labeled on the product may not be actually what's in there. And that becomes a dilemma. And so you have to go to reputable sources. But even there, when sources that should be providing you with good products where they know exactly what's in there, have been shown to sometimes not know what's in their product. A few years ago in the state of New York, the Attorney General went out to try to look at these types of products sold at places like GNC and other otherwise reputable agencies, and found out that many of the supplements that are listed there, many of the items, what is labeled on the bottle label is not what is in the bottle. And so once again, we're in that buyer beware position. And so we go to buy ginseng, or we go to buy echinacea, or we go to buy something and find out that that's not really what's in the bottle. And so you can end up sometimes having things actually dangerous that are in the bottles. So let me jump on into the items here. So again, I usually would go over minerals at this point, but we don't have enough time today to do that. So I'm going to start with some vitamins that we all probably need and that are necessary. But again, you should be talking with your physician before just taking lots of vitamins to make sure that they're in agreement with you, or that you can come to some compromise. B vitamins are very important. They're lost in the urine. So it really, you can't overdose on B vitamins. Some of the people that don't believe that we need to take supplements or vitamins say that we just basically have very expensive urine, because all these vitamins, like the B vitamins, just come out in our urine every day. But the case is that some of the vitamins turn out to be very important and are not well absorbed. So for example, like B12 is very important to us, but many people that have problems with their GI tract do not absorb it. And so monthly injections tend to work much better. In the old days, Many of the family practitioners would have people that are getting older or have lots of illnesses. They'd come in once a month to get their vitamin B shot. You know what? Those people actually felt better and did much better than people that were not receiving such shots. Some people may get by with taking it sublingually where it gets into their system. And an important point is you take B12, you need to be taking folic or folic acid or folate because both are required to bring about the functions that needs to be in place. Vitamin C is another one, and Linus Pauling used to take 10 to 12 grams a day and felt that people needed that. He felt that it protected you from colds, cancer, and other issues. Turns out it's very important for skin healing. And people that have gone on a variety of diets these days, scurvy, which is where the skin sort of breaks down, is occurring because they're not getting any vitamin C. So in this modern day and age, there are people that are developing scurvy because they go on these various fad diets when they're in great need of vitamin C. Many people say that it doesn't do anything of benefit, and again, you don't need to take more than just a little bit to prevent you from having scurvy. But Linus Pauling did win 2 Nobel Prizes, so he did have some insight to things. Vitamin C, again, the skin, blood vessels, and tissue healing is very critical. And it's another vitamin that you lose in your urine, so you really can't overdose, but it can upset the stomach in some individuals. And so some people are limited because it bothers their stomach too much. Most people can tolerate a gram a day and will not hurt them. And again, like the B vitamin C is lost in the urine and doesn't build up in the body. And so you really need to be taking it quite frequently if you're going to get the benefit from it. A and E. These are vitamins that are needed, but necessary supplements is debatable. Vitamin A, for example, is better to be obtained as retinoic acid or beta-carotene rather than vitamin A. And let the body digest and metabolize the beta-carotene in the proper forms. And one of the reasons for this is beta-carotene doesn't really cause inflammatory processes, but vitamin A does. And so I'll see patients that are getting too much vitamin A and are very achy or having worse arthritis, and we stop the vitamin A to make their arthritis condition get better. Vitamin E is something else that is needed, but the manufacturing of vitamin E makes products that can actually be harmful than helpful. So taking lots of extra supplements of vitamin E, I'm not sure is beneficial for most individuals. There are some individuals that have certain conditions that do need to take the extra vitamin E as well as beta-carotene or vitamin A, but for most that's not the case. Vitamin D is another interesting vitamin in that when I was in medical school, we were taught about a condition called hypervitaminosis D, and all we learned was it was very bad. And I kept wondering about what it was, and nobody could ever explain exactly what it was, but it was supposedly because you took too much vitamin D. Well, the truth of the matter was it was from cod liver oil because that was the source of vitamin D, and it was probably other things in the cod liver oil, not the vitamin D itself, that was causing harm to the liver, and that was where the issue arose. Taking pure vitamin D doesn't hurt. As a matter of fact, we know that you can take massive, massive doses of vitamin E without any harm to parts of the body. And it's very interesting. Every day when I go through my list of emails about what's going on in the world, there's a new article about the role of vitamin D in arthritis conditions, in cancer therapy, in neurologic disease, and they're all positive, meaning that they're all supporting that vitamin D is playing a role in helping these things. So I think vitamin D is something that's very important, and supplementation may be helpful. The RDU, which is what was recommended by doing studies on white rats, is only 400 units a day. That was found to be too low, so they doubled it to 800, but that's still too low for most people. Most people really need a few thousand units every day to bring about the benefit they need, but because of the controversy, this is again something that would be very carefully discussed with the physician before undertaking. Vitamin D, though, I think does provide lots of benefit in a variety of immune-related conditions. One of the other things about having vitamin B do as well as it needs is we probably need to have added calcium and magnesium to the supplementation with the vitamin D, because if you don't have all of these, then you're probably not getting the full benefit from it. But as I keep pointing out, please talk to a physician before you embark on adding these things into your therapy. One of the things that's very interesting, and 30 years ago, we knew that vitamin D receptors were found in T lymphocytes. Well, there's no idea about what they were doing. As a matter of fact, we still don't fully understand what they're doing, but it does suggest that vitamin D is doing something with the immune system that's very important. Vitamin D was thought to only regulate calcium metabolism, so help you get calcium into your body. But again, I want to emphasize that it does something to help regulate what's going on with the T lymphocytes, which helps regulate what's going on with our immune system. Niacin is another vitamin, and 1 gram a day will help get rid of the bad cholesterol and make your good cholesterol do better. It's a lot easier on most people than statins are, but it can cause flushing of the skin, which many people find very bothersome. There are slow-release forms of niacin, but most of those don't do as good a job of helping with taking care of the cholesterol. So niacin generally should be taken with food to try to help reduce the flushing if that's bothersome. There's concern about potential liver toxicity, so again, this needs to be used in great conjunction with your physician to make sure that there's no harm or problems arising from it. But it's a real good way to get your cholesterol down. Amino acids. And so this is interesting because this is what we're eating in our diet every day, since amino acids make up our protein. About half of the amino acids are from our diet that we can't make, but the other half we have the ability to synthesize in our body. Of all the amino acids that are out there, the one called glutamine is most important because it's the center of all the different metabolic pathways that we have in our body. Other ones that I think are very important include lysine and arginine. Arginine is metabolized to nitric acid, which helps with blood pressure, helps regulate blood flow, helps prevent things like strokes, helps get oxygen delivery to the tissues, and is critically important. Lysine is required to help healing of the body. So if you get a cut or something, lysine is important for allowing that to heal properly, and you get good integrity back of the skin or the blood vessels or the tissues that are involved. Another amino acid, although it's a combined component, is called NAC, or N-acetylcysteine, cysteine being the actual amino acid. But this is usually considered to be an antioxidant supplement, and I'll mention more about it in a moment. But all of these tend to be useful, and we probably don't get enough of these in our diet daily to provide the extra benefit that's helpful. As you can easily see from these metabolic charts, the role of glutamine in the central portion, and I'll leave it at that, to point out that glutamine is essential to everything. Glutamine is required for cells to grow in culture. High doses I shouldn't say high doses, but 2 to 4 grams a day have helped in conditions like inflammatory bowel disease, but it should be heavily discussed before going forward with therapy. Arginine, again, metabolizes nitric acid. It helps cause dilatation of blood vessels, helps reduce blood pressure, and helps get blood flow to all the organs. Lysine helps by cross-linking to strengthen the integrity of our tissues and is very important for the healing. And if you get mouth ulcers, taking lysine every day can help prevent and cure or heal up the mouth ulcers. Now, acetylcysteine, again, is used as an antioxidant because it helps to generate what's called acetylsomethionine, which is our circulating antioxidant that protects us from the oxidative damage that arises all throughout our day. Just to think about these things a second, the dietary amino acids, we're supposed to take about 56 grams a day. If you're taking a bunch of the supplements, you need to cut down on how much protein you're getting so that you don't create harm for your kidneys. There are other supplements that are out there. Some of the most important include the omega-3 fatty acids, and about 5 grams a day of this was shown to help reduce the need for things like aspirin to treat arthritis conditions. 30 grams a day was shown to be beneficial in psychiatric disorders such as bipolar disorder. Some studies suggest that omega-3s aren't as good as others, but every day, again, I see more and more studies that show benefit from it, and especially for heart health. Once again, one needs to think about the dietary intake. If you're taking a bunch of fat through omega-3 fatty acids, you should decrease the total body fats otherwise being taken so that you're not overdoing fat in your diet. Other supplements are out there. For example, like St. John's wort is used for depression, is how it's usually advertised. But it turns out its chemical is very similar to that of Prozac, and Prozac is regulated. St. John's wort is not. So you can't get a regular dose by taking something like St. John's wort. So you should take the medicine that works, not something that's totally unregulated. Echinacea has been prescribed as a cold remedy and suggested it helps with colds, and studies are mixed up. It's hard to know if it helps with a cold or not. But one thing I can say is I see it being advertised lots of the time saying it can cure your immune problem. It is not a cure for immune deficiency. I'm going to state that again. Echinacea does not cure immune deficiency and likely does not help people that have immune abnormalities. Ginkgo biloba is another supplement that has good benefit for helping blood flow. But in New York a few years ago, what was said to be ginkgo biloba on the bottle did not have any ginkgo present. So again, buyer beware. So there are a variety of other supplements, and DMSO can help with arthritis type conditions by reducing inflammation. It's used to treat arthritis in the medical world, but it's used to keep racehorses running by treating their tendonitis, so they rub down DMSO after every workout. It's not FDA approved, though, for human treatment. And if you take it, it makes you smell like garlic. If you put it on your skin, it's such a good solvent, it can remove the dyes from your clothing and tattoo your skin. So you have to be very careful about these things. Frankincense and essential oils are very useful, very helpful. They've been around for a long time. They're mentioned in the Bible. Melaleuca can help with mouth ulcers. This is a whole new industry out there, this blossoming multi-level marketing style. Most of these are very expensive, but usually you only need a drop or so at a time. But you need to be careful about whether it's the real stuff, the purity, and so forth, and not pay a lot of money for something that's not truly very valuable. Probiotics are very important. Things like yogurt and kefir tend to have at present, but most yogurt does not have enough to be very beneficial. So these advertisements for the yogurt to help your digestive system is really an advertisement. It's not as useful as what they propose. I believe that these help people, and if you're on antibiotics, taking a probiotic can be very useful to replace the bacteria you need in your gastrointestinal tract. There's reports that the organisms can cause problems in individuals with immune problems, but these were usually cancer patients that had neutropenia, so I think it's probably safe for most patients with primary immune deficiency. But some immunologists still will not give them. There's a fecal transplant where you actually put bacteria that's supposed to be good bacteria from individuals into those to help restore the normal gastrointestinal tract. And we do this with patients with bone marrow transplants. And it helps conditions like with C. difficile infections. There are new therapies that are out. They're actually old therapies, but we're using rat tapeworms that are given to people that have certain neurologic and immunologic disorders. And these tend to provide improvement, for example, in conditions like relapsing MS. It's not been studied in patients that have immune abnormalities, and I would worry about using this in patients with immune deficiency. Chiropractic care can be useful for biomechanical disease, but can't cure real diseases. I'm going to rush through these in the interest of trying to get to the questions. Acupuncture, we don't know exactly how it works. Somebody's well trained, it can be useful, but make sure they're using disposable needles to prevent infection problems. Hypnotism works. People have to be motivated. It requires frequent sessions to prevent the effects from being worn off. And so let me go through and point out that a lot of these things may work through the placebo effect, and That's why we also have to be careful, and that's where the testimonials may, while they're being genuine in what they believe is going on, it may be disingenuous because of the fact that it's really a placebo effect for them. The natural source of things can be beneficial. You have to be careful what you're getting and make sure you're fully discussed. And once again, the buyer needs to be aware that this is not regulated industry. And remember, there's a cartoon movie several years ago, and Bugs gave Michael secret stuff to all their cartoon characters, who then became very strong and excellent basketball players. And all it was water from the water fountain. So the placebo effect is very strong. Testimonials are not a reason to believe. There may be harmful items present in what you're getting. The supplements such as amino acids, omega-3 fatty acids, so forth, are actually relatively pure, but you have to make sure your diet is adjusted if you're taking much of these so that you're not causing harm to your kidney in particular. Minerals and vitamins are good, but one must be careful about overdoing the case, and again, it should be carefully discussed. Probiotics are probably fine for most individuals. Helminth therapy, I'm not sure that's helpful for patients with PIDD at this point. These other adjunctive things like chiropractic care, acupuncture, hypnotism, all very good, but you need to make sure you're dealing with somebody that's not trying to take advantage of you. What I suggest is that you use something like a naturopath or someone that's licensed in doing this and is well versed, not just somebody that's put up a shop to sell items in their store. And all this should be discussed with the physician and your immunologist so that you're integrating these things appropriately and not resulting in harm. And so thank you for your time, and we'll work on questions. And as I said, I'll hang around and answer any questions that we can't get answered in the time allotted. But hopefully we'll all make it to Disney. He has that. I'm sorry. And remember, all these will be available through the IDF, so you can pull down the exact thing so you don't have to worry about trying to scribble and write it all. That chart? Thanks, Lou. Oh, okay. Only 4. Oh, wow. Okay, the question asks about any word on silver biotics for antibiotic effect. And so that's actually a very good question, and silver has been used for a very long time as an antibiotic. So to treat venereal diseases many, many years ago, silver products of various forms were used and would be placed in the parts of the body where the infections were occurring, so down in the genital area. Some products that are used, such as stents in the bloodstream and so forth, may have impregnation with silver to prevent organisms from growing on those. There are people that were given very silver salts in the recent past that's being used to try to treat a variety of conditions. And the most I can say is basically their skin turns blue, and I'm not sure if they're getting much benefit from those items. As a topical process, there is even a medication we call Silvadine. It contains silver salts that's used to treat burns. And so these types of things topically are very good. I don't know about the utility of any of these that may be from a over-the-counter rather than being prescriptive. If you want to talk about this more afterwards, I'm happy to talk more about some of the issues there. Okay, what probiotics do you recommend for teens? Okay, that is a great question. And basically, it's the same for anybody at any age. It's just the number that you take may be a little bit less. Many of the probiotics come in a chewable form, and for younger children and those that don't like swallowing capsules or pills, the chewable forms work very well. Personally, I take what's from GNC, but I think any drugstore probably sells a probiotic that's pretty good. And if you could talk to the pharmacist there. But once again, you should talk about these things with your physician before embarking too much on them. Okay, here is another very good question. If you don't metabolize B12 very well, is there a type of it that is already broken down or bioavailable that you can take as a capsule? And the B12 isn't metabolized in that context. There are some modifications that arise on it when it gets into the body, but the B12 that we put in pretty much is what is utilized. The issue that we're talking about is that there's a material released by the stomach that binds to the B12, then that binds to receptors that are found in the terminal part of the ileum, so before you go into the large intestine, and that's where the B12 is absorbed. So if people have inflammatory bowel disease or things like Crohn's disease, that area is inflamed, the B12 doesn't get absorbed. And so there's not a pill form that gets into your body as a consequence of that. That's why you have to take it by a shot, or some people can absorb enough underneath their what we call sublingually, so under their tongue, to get directly into the body. But there's not a real good otherwise pill form to take if your digestive system doesn't allow you to get it inside of you. So this is a great question. Are there any good source of information on the web, like WebMD and other places? And there's always double-edged sword, whether it's on WebMD or any of the sites that cater more towards true Western-type medicine versus a site that's just trying to sell some items. It's always multiple sources and look through multiple ways for that. When I'm looking, I look for various sources. I usually go to look up articles that are written about the things. And so I'm using PubMed, which is for the NIH, and I'm looking them up and reading the articles to find out about it rather than trying to read the summary form that will come with another one. So if you think you can, then you'd want to go to a source like PubMD. Now, I've also looked at some of the naturopathic sites that train people to be naturopaths, that doing it in a licensed manner. And some of those are very good because they, since they're licensed, they have to be more honest about what they're putting up. So you might go to a naturopathic site that from licensed naturopath. Alternative treatment for warts. Yes, hypnotism makes warts go away. There are a lot of things that are done for warts. Zantac makes warts go away. And somebody wants to talk to me more about warts again afterwards. I can tell them more about that. Depending on the types of warts, how much, we also have to use alpha interferon or other medications, Cidofovir, other medications that can specifically help deal with them. This is a great question. After a gallbladder removal, do you have poor absorption of some vitamins, and are there good supplements for that? So theoretically, not, because the gallbladder just helps store the bile salts to help with the digestion of fats, but you still are producing the bile salts and will be secreting those. If someone, though, is eating an extremely fatty diet, then they may not be able to metabolize the fats as well as they should. But overall, you shouldn't have any problem getting the vitamins in or other supplements after gallbladder surgery. If someone's had any of the bypass surgeries on their intestines, so that's a whole different story. There will be malabsorption and difficulty getting them in from there. And so this is, what do you think of oregano oil? And it's good for flavoring foods. Some people, there's evidence for its use because it can kill bacteria. There's evidence that in culture systems, it can kill cancer cells. I'm not sure how to use it in someone except on the skin or in foods, dietary-wise. I don't know how to think about taking it for help otherwise. But I'm not sure that what it does for helping infections or minor infections or lesions is any different than frankincense, myrrh, or any of the other similar types of materials. Okay, and this says, what company of essential oils do you find reputable? Because of my disclaimer of not wanting to do anything fiduciary or financial, I don't think I can list a company to say go to them and get their products. If somebody wants to talk to me personally on that, I can talk about some of the companies. I just don't want to be advertising for companies up here on front. I'm sorry. But I can talk to you about some of the things that are out there, though. Those are all the cards. Does anybody have a question that they didn't put on a card they'd like to ask or want to come talk to me afterwards? Well, thank you very much.